Hi, it's Dr. Paul Jared Frank, Director of the 5th Avenue Dermatology, Surgery and Laser Center. Welcome to one of my educational videos. Today we're going to be talking about Kybella, which is the hot new treatment for under the chin fat. Kybella is made of a substance called deoxycholic acid, which is technically a bile salt. It's a naturally occurring molecule found in the human body used to absorb and digest fat. Now, when injected directly into the fatty layer of skin, particularly in this area, we can actually specifically destroy fat cells without hurting surrounding tissue. Now, although it's a series of small injections, it's not quite like coming in for a Botox shot or a filler shot. This is actually a procedure, and it's one that may take a few treatments, anywhere from 1 to 4 treatments depending on severity. It's also one that has a little bit of downtime. It can cause some bruising or swelling. So it is not a magic injection, it's not a lunchtime procedure, but it really opens up the Pandora's box to the non-invasive fat removal area of my practice. Now, traditionally, one of my areas of expertise is in tumescent liposuction, laser liposuction, and various other techniques. One of the procedures I developed is called ultra-tight, which is a minimally invasive treatment to treat this area with a short downtime. So there is no best option for patients. Really, patients need a consultation to come in to find out which is best for them. The fact of the matter is people don't have to live with this anymore. And as long as you maximize diet and exercise and you have a small pocket of fat left, it makes you a great candidate for one of our treatments. So we're going to take a short break. We're going to bring in a patient. I'm going to show you one of the treatments that we're doing today, all with just a few little injections. So if you have any questions, okay, we're back now. I have one of my favorite patients here who's been waiting to do this treatment for a long time. She wanted to avoid any surgical intervention of any kind, and she's actually the perfect candidate. She has a small pocket of fat. She has good skin elasticity. She's young. There's no like hanging skin here, and this is the type of patient you want to treat with Kybella. And certainly one where we could avoid making any holes or surgical intervention. So I marked out exactly where we're going to do, and I'm going to bring you back in a minute. I'm going to have her marked up in terms of where the injection is going to go, and she's going to be fully anesthetized with local anesthesia. Okay, we're back and we're ready for treatment. She's numbed up, which is why the area looks a little full, and she has this like little grid mark. The substance is clear. We inject 0.2 cc's into each hole as we go across. She shouldn't feel anything, and afterwards she shouldn't have any problem. What we're going to do is we're going to put on a bandage, a little compression. Sometimes we give a cortisone pill to minimize any swelling, and it's quite easy. I'm going to do one row, and then I'll finish her up on my own. So we start here, and we inject 0.2. It's really as simple as that. Okay, so I'm going to finish her up, and we'll see her on post-op. That was Kybella. Have a good one.